Art is important for everyone who's in the environment. So everyone from the cleaners to the nurses to the doctors to the patients.
If we put something on the wall that is more meaningful or hang something from the ceiling that's more meaningful, our lives are actually improved and more meaningful. UC Davis Medical Center started their collection in the 80s, so they've been thinking along those lines for a long time.
There's been a number of studies indicating that if you in fact have good quality art or a pleasant environment, that you tend to get better clinical outcomes.
You're trying to create an environment that they may be in for several minutes, maybe a half hour, that is pleasing and interesting, that makes them feel that they are taken care of. Every piece has an identification tag that lists the name of the artist, and I think it makes people feel that we're looking at our community and using artists from our community who also, in making their art, are probably reflecting the community.
I've outlined the shape of the river, Sacramento area, in this painting, so I'm trying to reference local geography, history, and also pull in like ideas about healing in the body. As I add a layer, the layer on top also needs to speak to the layer below, so they work together and build a story. And so you get this three-dimensional, and you can actually see a little slight shadow from the lines. I like to have that. You can look at a painting and it takes you somewhere else. And whatever that experience is, it might take you out of that moment of stress or anxiety.
I need to create something that kind of calm people down in a way, soothing their soul and mind.
One of the most interesting things about making sculpture is how people kind of personalize the experience of it. And I think that the people here are really well poised to do that.
I was focusing on kind of the chaos. I kind of wanted to replicate this, to juxtapose the quieter aspects of this building.
There's a long history of using art as a therapeutic initiative and as a therapeutic approach. And you can suddenly be in a different place.
Okay. 1, 2, 3.
You can be feeling differently, you concentrate on that, you focus on it, and then, you go in a different direction.
Good job, Tom.
We have a lot of patients who've commented on how nice it is to come into the gym and to see the painting. They see the art for the first time, they always smile and they always comment on how special it is, how neat it is to have art like that.
Coming into any medical environment, but especially into the cancer center, it can be pretty scary. A lot of doctors' offices are sterile, white walls, very clean looking, but it doesn't help that fear and that anxiety that patients and children have. The instant you walk into our waiting area, there are pictures and color and things that help kids calm down and relax. There's a needlepoint of fairy tales, and it's many different fairy tales all put together. And so kids like to come out of their clinic room and they try to guess which fairy tale each part of the picture belongs to. If it was just a white wall, I wouldn't be able to use that or help a child to calm down.
You don't want to be in a sterile, sort of, purely white, purely beige type environment. We need to just brighten up the atmosphere, and at the same time, that relaxes people.
Real artwork can decorate a place, or you can decorate the place with work that, is a digital print of a painting and it's been made 1,000 times over. And there's a flatness to that work, and I think the kind of easy way to think of that is decoration versus real artwork. It's handmade, it's original, it's culturally enriching.
Really, art is about communication, and it's a way that the health system itself can communicate to both patients and to all of the staff in an effort to literally make them feel better.